Alright, so your adrenal steroids, these aren't like your anabolic steroids. So these aren't going to be steroids that make you grow big muscles. Instead, they're going to be steroids like mineralocorticoids, glucocorticoids, and then some gonadotrophic. And they're each released from different layers of your adrenal gland. Your adrenal glands are going to be these little glands that are found on top of your kidneys. They kind of look like little pyramids. On the adrenal cortex, that's where these steroids come from. Sometimes they're called corticosteroids because they are from the adrenal cortex. It's where all these steroids are going to come from. And then in the adrenal medulla, you have the release of catecholamines, stuff like epinephrine, norepinephrine, and dopamine. So in the three layers, first you're going to have this connective tissue layer, this capsule. And then you're going to have the first layer, the zona glomerulosa. This releases mineralocorticoids, stuff like aldosterone. Then you get the largest zona, your zona fasciculata, which is going to release glucocorticoids like cortisol. And then down here, the zona reticularis is going to release your gonadotrophic, stuff like DHEA and estradiol. The release of these corticosteroids is due to the HAP axis, the hypothalamus, pituitary, adrenal, or HPA axis, hypothalamus, pituitary, adrenal gland. And so there's a lot of communication going back and forth, up and down, between these three glands, causing the release of these different hormones at different concentrations. Typically, the one that a lot of people are focused on is cortisol. It's related with stress and that kind of stuff. And so a lot of people study cortisol. Your cortisol levels fluctuate during the day, and they're typically like highest in the morning and then drop off later in the evening and then come back up in the morning. And again, all controlled through here. Your glucocorticoids, you have your naturally occurring ones like cortisone and hydrocortisone. You might get shots of these if you have inflammation, like in a joint. Then we have our synthetic ones like prednisone, and then your long-acting like dexamethasone. Different conditions that use your glucocorticoids will be stuff like allergies. If you have an allergic reaction, or a bee sting, you can put cortisone or hydrocortisone on it, and it causes that allergy to decrease. Because what these steroids do is they stop the production of prostaglandins and your leukotrienes, because they stop the production of arachidonic acid, which we've talked about before. You can also use it in collagen disorders like lupus or rheumatoid arthritis, eye diseases like allergic conjunctivitis, again, gastrointestinal diseases like inflammatory bowel disease or ulcerative colitis, inflammation of your bones and joints, neurological disorders, especially cerebral edema following brain surgery, because it's going to stop that inflammation response. Organ transplants, because it's immunosuppressive, it's going to stop you from rejecting that tissue, because it decreases your immune response, because they can't infiltrate where the organ is, right? Also renal disorders, skin diseases, thyroid diseases, and then a bunch of other stuff like mountain sickness. Then we have our mineralocorticoids, aldosterone. We've talked about it a lot, where aldosterone is going to retain sodium at the expense of potassium. And so you're going to retain water. You are going to make less urine, right? And so what it does is it activates the production of proteins that exchange that sodium and potassium across the cell membranes. It's going to be bringing in the sodium and kicking out the potassium. It activates two different reasons. If you have a lot of potassium in your body, then you're going to want to get rid of it, and so the aldosterone will be made to get rid of it. or in response to angiotensin II, if you remember the RRA system with renin angiotensin system. Typically, it's only indicated if you have hypoaldosteronism, and that's due to tumors on the adrenal gland that stop the production of aldosterone. If you get too much of it, you can get edema, hypertension, arrhythmias, muscle weakness, the edema because you're retaining all that water. Same with the hypertension. The arrhythmias is because you're losing too much potassium. Same with muscle weakness. And that's it for the mineral our corticosteroids. It's pretty short.